Welcome back to another episode of What to Expect When Being Placed on Hospice. Hospice nurse Julie here, and this week we'll discuss end-stage kidney disease. So I'm specifically talking about anybody who has end-stage renal disease and has stopped dialysis, or anyone who's had an acute injury, acute kidney injury, so kidney failure, but quickly, which is kind of rare, but it does happen. It is a little different if you're passing away from kidney cancer, so I'm not talking about those patients. So this disease process while dying is pretty straightforward and for the most part has very little symptoms. The biggest ones I see are confusion and itchiness. And then of course you have your typical death and dying symptoms, which is sleepiness, lethargy, decreased functional ability, and then not eating or drinking very much. One of the main things we look for is when the patient stops urinating totally, because sometimes even after dialysis, they'll still make some urine. But once the person totally stops making urine, which won't be uncomfortable, that's when you know they have about one week left, 1 to 10 days, I'd say. It's pretty concise. So that's one thing with end-stage kidney disease, we do have a pretty good timeline of when the person will pass away. And during that week, you'll mostly just see them sleeping. And for the most part, not many symptoms. This is one of those diseases where the patient does seem to just fall asleep and pass away. And again, everyone is different. So I'm sure there are people out there who did not have that experience. But from my experience, for the most part, this is a very gentle disease to die from. Please let me know if you have any questions and like and follow. Thanks.